Good morning. I hope you're joining us today on Apollo 24/7's Health Hour. In today's live session, we are bringing you an Apollo expert neurologist with more than 35 years of experience, Dr. Dhanaraj. He's going to join us live today at 11 a.m. You join us and ask all your queries about neurological conditions, which could range from headaches to migraines to any nervous disorder or brain stroke, Alzheimer's or seizures, anything you think that you want to ask a question about. Join us, ask your question, and we shall bring you an answer from the expert. See you there, 11 a.m. today.
It's always been there, standing between you and your health. A wall, between a pain that won't disappear and a doctor who magically appears. Between a long wait on a hospital bench and staying right where you are, at home. Between finding yourself out of medicines and finding them at your doorstep, whatever the time. Between years of health records all over the place and all your records in one organized access from anywhere place. Between your current regimen and the recommended routine. The wall. We don't need it anymore. Say hello to Apollo 24/7. This is India's largest end-to-end omni-channel healthcare ecosystem, designed to touch more lives than ever before and delivering its promise in 3 important ways. 1. Listen. Talk to us anytime from anywhere. We've got 7,000 doctors and 30,000 healthcare professionals listening. 2. Advise. We'll give you expert advice you can rely on, because it comes from India's #1 healthcare provider. 3. Assist. We bring you India's largest health network of pharmacies, clinics, hospitals and health insurance experts. 20 million people already trust us for their care, and a further 50,000 people are discovering this every day. Apollo 24/7. Expertise is for everyone.
Namaskar, welcome to Apollo 24/7's Health Hour. Every week we bring you an Apollo expert to your doorstep where you can ask your questions in the live session. In today's session, we are going to talk about neurological disorders and stroke, what to know, what to do, and how to take care of your neurological conditions. Joining us very shortly on the show is Dr. M. Dhanaraj, who's a senior consultant neurologist, Apollo Hospital Greams Road, Chennai. You can ask all the questions which are neurological related, and I see already YouTube chat is buzzing with questions. Go ahead, type all your questions. I request all the participants of the show to type all details possible in one message so that I can ask the question to doctor and get you an answer. So before we start the show, let's also talk about this wonderful initiative called Saving a Child's Health Initiative. SACHI in short. This is going to be a wonderful mission. If you know that somebody requires a free pediatric consult, somebody is underprivileged child, and you want an Apollo expert pediatrician to take care of the child, scan the QR code where Apollo 24/7 and Apollo Foundation are on a mission to make quality healthcare accessible to underprivileged children at no cost. Share this good work and share all the details. Chalo, let's start today by also talking about COVID recovery. All of us are some way or the other impacted by COVID. Either we have recovered from COVID or somebody in our family has recovered from COVID. So understanding COVID recovery is also very important. What is happening in us is also important. So track your COVID recovery. There's a simple self-checker, which is an AI-driven tool developed by Apollo 24/7. You can understand when do you require a medical help and when do you have to actually go see a doctor. So take this 5 minutes free assessment. start this assessment. There's a link in the chat, and you can understand how well you have recovered. Or in case you require some kind of medication or help, Apollo 24/7 is always there for you. Download the app and get the best of the best benefits. Let's start today's show. Today we are going to have a great experienced doctor, Dr. Dhanaraj M, who is a senior consultant neurologist at Apollo Hospital Greams Road, Chennai, who has more than 35 years of experience in neurological practice. He specializes in cases of stroke, epilepsy, movement disorders, and migraine. He has received Lifetime Achievement Award from Tamil Nadu, Dr. MGR University. He has published books, Acute Cerebrovascular Disease, Critical Care Neurology, and he is an author of several papers in international and national journals. Namaskar. Welcome to the show, Dr. Dhanaraj. Dhanaraj, vanakkam, and it's a great pleasure and honor having you on this platform, sir. Thank you so much.
Thank you.
Sir, I know it's a very precious time for you on Sunday, but you have chosen to be with us on Apollo 24/7's Health Hour. It means a lot to us, sir.
Yes, ma'am. Yes.
Thank you, sir. Sir, let me start with a simple question. Ki headache jo hota hai, how do I differentiate if a headache is normal headache or it has to do something with neurological disorder, something like migraine? Does it also affect is it an indication that my neurological health is impacted?
Headache, a migraine headache is a long duration headache, maybe months, years like that. So it comes intermittently, maybe once in a month, once in a week, once in 2 weeks, or like that it comes here and it lasts for a short period. Maybe it lasts for about few hours, it goes. On the other hand, there are some headaches which are a few hours, few days duration, unbearable, severe headache coming on over a period of say 1 hour, 2 hours. Such situation, we think in terms of very serious neurological disease like a bleeding in the brain or rupture of the blood vessels or some blood clot like that. Whereas migraine is a chronic problem. So it is quite easy to identify a migraine. Whereas anybody who has got a short duration headache and it is very severe, unbearable, associated with vomiting, with or without fever, you have to admit immediately and take care of it. It's an emergency. Yes.
So that is a different case. But migraine, as you said, is a chronic situation where one deals with it on a continuous and a long basis. How do we identify migraine, sir?
First is the migraine headache, as I told you, it comes intermittently. It is not a daily headache. It comes, say, once in a week, say, or twice in a week, or monthly 3 or 4 times like. The migraine headache is characterized by an aura. Before they get the headache, they'll have a mild visual disturbance they may have. And next, the headache will be, most of the time, it will be restricted to one side, hemicranial. And as the headache becomes more and more, it may end in a vomiting here. And once, quite frequently, once the vomiting comes, the headache subsides or the headache is relieved by taking rest here, I think. So it is this nature. We have an aura, unbearable headache, not able to see, hear the sound, not able to see the light during the time of headache, and subsequently end in a vomiting, and which relieves the headache. This is the characteristic feature of migraine. It is not a daily headache. It comes into, that's it. You can easily identify migraine.
So there must be some triggers if it's not a daily thing. It must be, there must be an onset trigger.
Yes. So we have a genetic, a person is prone for this migraine. Such a person is exposed to the specific triggers. The trigger will vary according to the patient. But the common triggers, each patient has got its own trigger. For example, some women you would have heard, they take migraine once they get a head bath. When they head bath, they take it, they get one. And again, women are prone to get it during the time of periods. So we have a specific triggers for each one. Common triggers are exposure to sunlight, lack of sleep, tension, stress, hunger, not taking food at correct time, not sleeping well. Specific smells, some people, the body spray can trigger this migraine. Certain specific food, yes, specific food, particularly some food which are rich in oily or fried food like that. Travel. So like that, each individual has got its own triggers in triggering this migraine. If you can identify these triggers and if you can request them to avoid these triggers, to some extent we can avoid this migraine here.
Right, sir. But are there any ways to treat migraine, or one has to just bear with this? What are the kind of can I avoid the triggers, or is there a treatment?
There are two ways. Always we have the treatment. See, we have a medical treatment, non-medical treatment. The
Okay.
non-medical treatment consists of avoiding the triggers.
Right, sir.
And the commonest one is the stress. We don't, everybody has got stress now. So
Yes, yes.
one way you should know how to come out of the stress. So this is a non-medical way of how you treat this one. Now, when you come to the migraine treatment per se, we divide into migraine which is occurring very low frequency, say monthly once, monthly twice. Such people, they don't need a long-term therapy. Such people can be treated at the time of onset of the headache. They can be given the particular painkillers to control the migraine. But suppose the same patient is getting migraine frequently, say weekly
Okay.
once, weekly twice, like that, then you may have to need a specific type of treatment called prophylactic therapy. So there are
Okay.
certain medicines that are available, prophylactic therapy. We have amitriptyline, propranolol, we have topiramate, like that we can. So we can choose the drug according to the patient and we can give it. So therapy is individualized. It is not a,
Right. So if, for example, my cook has migraine, I can't use the same medication to somebody who's my colleague who has migraine. Their triggers
uh,
and their stress,
uh,
everything differs.
uh. So identify the trigger, eliminate, I said, put them on the appropriate medicine. Generally, if the migraine is a short duration, say 1 year, 2 years, they can be made all right with simple drugs like propranolol, amitriptyline, like that. And these medicines have to be given for a period of minimum 6 months free from headache. See, what happens is
Right.
quite frequently they take the medicine for 1 month, stop the medicine, come back again with relapse of headache. So they shouldn't do
Yes.
like that. They have to take minimum 6 months free from headache, and then the medicine has to be gradually tapered. It should not be stopped
Oh,
abruptly. So if we can follow the principle, 85%, 90% of the patients with migraine can be successfully treated.
great, sir. Great. That's an interesting and positive note that you have shared today. Requesting all the participants and audience who are watching the show live and asking questions, हमें ये हेल्पफुल होगा कि आप पूरे डिटेल्स एक ही मैसेज में अगर डालेंगे एंड ऑल्सो अगर एक बार क्वेश्चन विद ऑल डिटेल्स डालेंगे तो हमें बहुत हेल्पफुल होगा. बार बार क्वेश्चन पूछने की जरूरत नहीं है, हम लोग देख रहे हैं आपके क्वेश्चन को हम पूछेंगे सर से. So I would request you to put all the details possible in one question itself rather than splitting your question. Right. So Dr. Dhanraj, let me continue with stroke. Brain stroke, aajkal we are listening to brain stroke very rapidly, rampantly. It is, we're hearing about this. Why has it suddenly become so rampant, and how do we identify a brain stroke?
See, it all depends upon the risk factors for the stroke. The risk factors for stroke and the heart attacks are almost the same. We have a hypertension, diabetes, cholesterol problem, smoking, and the heart. I told you the heart rhythm abnormalities also. These are the common. I personally feel alcohol is also a stroke, one of the important cause for this, the risk factors for this stroke. Plus,
Okay.
now added modern life, we have a, well, the lifestyle. People, there's no proper sleep. They don't sleep well. They have to work at the night time. They have to work. I think the food habits they are going now. It is different than what type of the food they have. The incidence of the obesity has gone up. Excessive salt. You have got to take the food from outside. More preservatives are available here. So all these parameters, lack of physical activity, put the patient into a trouble. There is a high risk of diabetes, high risk of hypertension, and of course smoking. I think is again all these are put into the it raises the incidence of stroke here. I think the
Right,
incidence of
sir.
stroke in India is about 120 per 100,000 population, approximately.
Oh,
120 to 130 per 100,000 populations in India. It is there.
it is quite high then. That way we are.
Simple. If you work out the population of Chennai, for 11 million populations here in Chennai, the incidence of stroke per year is about 13,000 and odd. And every day in Chennai, as per the calculations, about 35 to 40 people will suffer by stroke every day.
Oh,
So
so let's understand the risk factors of strokes. Who is at risk other than the smoking and alcohol and lifestyle? What else can be looked up as
there,
a stroke?
there are certain other, the predisposing factors, like one say, for example, family, well, there are some families, the incidence of hypertension is high. Even at the quite young age, 35, 40 years itself, there is risk of this hypertension, risk of this heart problem. Such peoples are also at a relatively higher risk. And of course, as I told you, the total physical inactivity. So the familial age, anybody who are above the age of 78. So these are all called unmodifiable risk factors. These
Right.
can be, we have a modifiable risk factors, unmodifiable risk factor. Age is one of the unmodifiable risk factors you have got. Age, race, place you are living here, I think. All these could be, we may not be able to do much, I think, but can be prevented even then at this point.
Right, sir. So I've been listening that one has to act really very fast in the times of stroke, and identifying
Yes,
stroke is important. So
yes.
can you please elaborate on this, sir?
Earlier, say about 2 or 3 decades, there is no specific treatment for stroke except for general care. Today, we have a specific treatment called, clot busting. So there are some medicines available. This clot in the brain can be lysed by giving an injection intravenously here. This medicine has to be given within a period of about 4.5 hours to 6 hours. So, if a patient has got a stroke and if the appropriate specific treatment has to be given, the patient has to rush to the so called stroke ready hospital
Right.
as early as possible. There should be no delay
So
at
not
all here.
just a general hospital, but a stroke ready hospital.
Where you have these facilities for handling stroke is available. See,
Right.
I cannot go to a hospital, a smaller nursing home, where they admit the patient, send the patient somewhere else for a scan, bring here, and you lose your valuable time there. Go to your center where you have a stroke available, acute treatment is available. Go there, I think. Do the investigations quickly. For example, in some of our, you have got this Apollo. Even in the ambulance itself, we have the treatment is available. They can bring it, they inform the casualty. So as soon as the patient enters, whatever called the door to needle time. By the time you enter into the hospital, do the investigation, within 60 minutes, the medicine is given intravenously so that we are able to treat the patient successfully within the window period. That's called the golden period or the window period.
So the mantra, how do I realize that this is stroke, and when do I act and how do I react?
Common terms, we can't tell the community these are all the different symptoms of stroke like that. Just remember the term fast. Act fast, fast. So when a
Fast.
person develops, suddenly there is a facial lag. There is a suddenly he's not able to, his arm has become weak. Suddenly he has got a speech difficulty. These three signs itself is sufficient to push in the patient immediately to the hospital. That's a time. So fast, face, arm, speech involvement, and the time. Quickly call for an ambulance, take him to the hospital here.
That's a mantra to remember, which is called FAST. Thank you so much, doctor. And one question about brain stroke, post brain stroke. What are the chances of recovery? The chances of
Exactly.
recovery from brain stroke के chances of recovery.
The chance of recovery with the availability of this modern medicine, the chance of recovery is very well. For example, those patients who have received this thrombolysis treatment, most of the patients, the recovery rate is very high. So in olden days, before when we were all students there, I think when we see the stroke, I think 1/3 of the populations will affected with stroke will die in a matter of 1 month. 1/3 will recover with severe neurological deficit. Only 1/3 will recover. Today, we can see almost about 50 to 60% of the patient who have taken this thrombolysis recover fully, able to go back to the job, within 1 to 2 weeks of this treatment here.
Wonderful, doctor. And let's move on to epilepsy, doctor. What is epilepsy and how does one identify that this is epilepsy?
See, epilepsy is a what you call as a paroxysmal disorder. Sudden, a person who is, I can't tell, there are various criteria of epilepsy there. When you see a person, suddenly, tuck, just like that, he loses convulsion, loss. There's a loss of consciousness, and we have the convulsions here, I think. So this is due to some electrical discharge coming from the brain. So epilepsy is due to an abnormal electrical discharge coming from the brain, characterized by sudden loss of consciousness and convulsion. This is called epilepsy. This is
Right. And who is there a test to diagnose epilepsy, or who does the diagnosis?
epilepsy is primarily a clinical diagnosis.
Okay.
Epilepsy is a primarily, so it depends upon the clinician to diagnose what is epilepsy. Epilepsy has to be differentiated. For example, a person with a heart problem, well, the heart block. We have a so-called Stokes-Adams syndrome. Suddenly he'll be top like that, he'll fall down. Like that is not epilepsy, and there the loss of consciousness will be for about a few seconds, 1 second, 2 seconds here, I think. Anybody after the age of 70 loses a consciousness like that, think of a heart problem, not epilepsy.
What else?
So epilepsy is the one, there's a sudden loss of consciousness, convulsions lasting for about 2 to 3 minutes, and unconscious for about another few seconds recovery. So it's a clinical diagnosis. There are some tests are available. The test may support or may not support. We have a test called EEG, electroencephalogram. I think most of the patients today now with epilepsy also undergo imaging of the brain. Mainly you have a CT scan or MRI, mainly to find out what is the cause for epilepsy. There may be
Right.
a small tumor may be there may be a infarct, stroke may be there may be a small infections. I told cysticercosis, it may be there. Mainly to identify that only we do either a CT or MRI brain.
Right. So one last question from my side before I take questions from audience. How do we differentiate between normal aging memory loss and an onset of Alzheimer's?
See, normally, once you go to the age of about, to say, about 70, 80, there will be a mild memory loss, but still they'll be able to do all their activities very well. Whereas in Alzheimer's disease, by about, it can start about usually around 60 to 75. There is a rapid memory loss. And if
Okay.
you do an imaging of the brain, there will be an atrophy of certain specific parts of the brain which are concerned with, which do not happen in a age-related memory. And over a short period, those with Alzheimer's disease will lose their memory. They'll be dependent on others for their daily activities here, I think. We can differentiate in a matter of once you follow the patients, whether it's
And they must
Alzheimer's.
be,
Yes.
yeah. Is
For
there possible treatment, sir, for
See, there
Alzheimer's?
are for Alzheimer's disease, there are some treatments are available. There are drugs are available to improve the memory, but in general, they are useful at the very early stage. So, if you ask me very clearly, the treatment as on today available for the medical management of Alzheimer's is very limited. It is not a
Okay.
very successful, you say, but only a good care. That is a
Okay.
more vital. That is a
Done. Doctor, there are questions from audience today. A lot of questions around headache. I shall take them orderly.
okay.
First question I would want to ask is from Ms. AK. He has a condition called L5S1 and foraminal nerve compression with abutment of thecal sac due to injury in 2013. Can it affect my heart?
What L45? L45.
L5S1.
It is not going to affect heart. Heart and these are totally different. The L5S1 lesion is lower back down here, I think. Heart is quite above here. There's nothing to do with the heart.
Right. So he also has left ventricle hypertrophy. Is this due to my spinal injury? Is asking.
No, 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 no,
No. So not
no,
all spinal injuries
no,
lead to
no,
other.
no, no, nothing.
Okay. Done. So this is Sampad Saha. The question is, my cousin who has 10 years old having constant headache but they could not find anything. What could be the reason?
See, so as I told you, the headache, you have to identify whether the headache is a short duration or a long duration, whether the headache is an intermittently it is coming or it is there every day here. Long durations headache, if it is there more than 2 months, 3 months, 6 months like that, always an imaging is necessary. We have to do an MRI brain with MR venogram, identify. In
So,
case if there is nothing is available, all imaging, everything is normal, and the headache is of long duration, we can be very firm that we can treat it medically with simple medicines. We can manage and treat it here. I think.
done.
Short
Sampath,
duration headache.
yeah. In this case, Sampath says the MRI is normal, so they can
Ah,
consult you on Apollo 247 for further
yes,
treatment.
yes,
Yes, sir.
yes.
So next question is Mr. Rao SPL. My mother-in-law is 58-year-old diabetic since 15 years and BP is also there. She's having a habit of head shaking. Why does this happen? We've not seen a neurologist till now.
See, head shaking is a relatively a common abnormal movement seen in relatively in elder people. Relatively, you can see they will do a shaking of the head, it's called a titubation, it is there. In generally, the head shake, if it is only head shaking, we can wait and see. There are some medicines available, we can try to control it one. But if it is only head shaking, we can wait. But if it is associated with the shaking of the hand, leg, like that, we may have to look up the other causes for this head shake.
Okay, right. We used to have a very famous heroine who managed her career with the head shake, if you remember Jamuna. In Telugu. Yes, she managed very, very well. That head shake also she managed and she lived and she
There are some
acted really.
politicians also had head shaking. There are top politicians. Their head shaking
Yes.
was there. Nothing. It is
All
quite
right.
harmless condition.
Done, sir. So, a lot of questions around headache, where people are saying that while they have to use laptop due to work or due to classes, so laptop is also causing headache. How do we overcome this kind of headache? Eluri Kamal is asking.
See, when you have a headache, which is triggered by seeing, say, laptop, particularly cell phone now, I think it is better they have a consultation with an eye doctor. Check
Correct.
them with the whether there is some hidden refractory error, something like that. And always when you identify that when you look at the laptop for a very long time, I think you may have to take a gap. Maybe you work for about say about 1 hour or something like. You give a time gap for some more time, 5-10 minutes, I think. Then again work like that, I think it's better. But preferable to consult an eye doctor also.
Done, sir. So here's another question. My wife is 48-year-old, has a CSF leak issue and it got resolved after 6 months. Do we need to suspect if this will impact brain internally?
See, if the CSF leak is already subsided and there is no CSF leak, it can be, you can leave it as it is, I think. But if the CSF leak is persisting, I think it has to be treated. It has to be. So it all depends upon whether it has subsided, I think. But he should tell from where is the CSF? Is it from the nose or from elsewhere?
So
Ask them
it
whether
is
the
not.
CSF.
Yeah.
If there is a CSF condition called CSF rhinorrhea, it comes from the
Okay.
nose. It has to be treated immediately. If it has been already treated, there's nothing to get worried.
Okay. Okay. So there are two questions that I would want to take up on headaches, sir. One is Nageshwar Jha, who says that he's having a headache every day, and the other one is Reem Tariq, and headache on everyday basis. How do we manage this?
Yes, yes. See, there is what we use the terminology called chronic daily headache. In fact, this is the commonest headache we see in more than migraine. These are the people everyday headache, 2 years, 3 years, 4 years, everyday headache. Common trigger is stress. Every day there is a stress, or whether there may be stress or there may not be stress, they may think that they have a stress. So such people with chronic daily headache, there is a specific medicine called amitriptyline. It is available.
Okay.
Yes. And if they have any psychological stress, they have to better to have a consultation with a psychiatrist or a psychologist. If it is anything, has to be rectified.
Done. So this is a question from Jagdish. He has this half side headache, and what is the reason? 59-year-old male, and also one side headache. Deepak Patra is asking, what is this one side headache? Is this migraine, sir? Properly?
Yes. I have told you earlier this migraine. Migraine, the classical migraine. The classical migraine is characterized by an aura. You have the visual aura, followed by you have the headache, usually opposite side of the aura, unbearable headache on the one side. Then, as I told you, photophobia. They may not be able to see the light or the sound at that time, followed by intense vomiting. This is a very characteristic feature of this migraine. As I told you, I think it can be treated very effectively. Today, we have so much of medicines available, so many things are available. They can go ahead, the proper medicines can be taken and can be controlled easily.
Okay. So here's a question from Tamire Krishnamurthy. Sir, my wife Bhagyalakshmi, 56-year-old, for last 5 to 6 months, she's not sleeping. Even if she is taking sleeping tablets, she is not able to sleep well, and she has a lot of other issues because she is not sleeping. Is this also a neurological disorder?
It is a primarily, lack of sleep. Again, look into their stress. Anything they are worrying, they are keeping in their mind something disturbing, and to check whether they sleep in the daytime also. There are some people who sleep for about 1 hour or 2 hours in the daytime. They don't get sleep in the night, I think. I'm not sure what is the one. But if the stress is the most of the time, the stress will be the common problem. Identify the stress, relieve the stress, I think. For a short period, a sleeping pills may be useful for them. And little physical activity. Ask them to go out for a morning walk. A little physical activity, a balanced diet, restriction of sleep in the daytime, short period sleeping pills would help them a lot.
Right, sir. Reem Tariq's question, what are the reasons for mild involuntary hand shaking? Does it require treatment? And what do you think is the cause for it?
See, what is the age of the patient? Anything they are telling this?
रीम तारिक जरा आपका एज बता दीजिए हमें यहाँ पर if you can please type the age. I will wait for the person to answer.
Sure. See, tremor, that is, I think handshaking is the tremor. Tremor can be due to multiple causes. One of the cause only is a Parkinson's. But
Okay.
Parkinson disease, yes, Parkinson disease,
Reem Tariq, it's 27-year-old, sir.
27 years old means we can keep it. So 27 years old means there may be even thyroid excess can produce a tremor. Little anxiety can be a tremor. A familial tremor, you have a running, the tremor can run in families. They can also produce the tremor. Ask them to check. There is a test called ceruloplasmin to rule out a disease called Wilson's. Check for the thyroid. If they can rule out, I think there are specific medicines available for the tremor. If the tremor is disturbing their life, we can take those medicines there.
Dr. Anil Kumar Sharma ji is asking this question. Is there a permanent treatment of Parkinson disease?
See, Parkinson disease is a degenerative disease of the brain. There's no cure. So if a person gets a Parkinson disease, the chance of the disease becoming more as the years go is high. So there is no cure for Parkinson's disease. But there are some disease which mimics Parkinson's. For example,
Right.
there are some drugs which are taken for gastric problem, Pan DSR. Such drugs containing domperidone and levosulpiride, along with this pantoprazole, can produce a Parkinson-like picture. One should identify, stop the drug, they can free from medicine, drugs.
Oh,
But
nice.
Parkinson disease per se, there is no cure.
Okay, sir.
You can
So
control
Mayank
this.
Kumar is sorry, sir.
You said,
Yeah,
yes.
next question from Mayank Kumar question. How much time will it take to treat epilepsy? I have sudden loss of consciousness and I'm on medication since 10 years.
Usually, in generally for a patient with epilepsy, we give a treatment for a period of around 4 to 5 years free from fits. So if a person is free from fits for about 4 years, 5 years, you can have a discussion with the family and then try to taper this drug. But then, if the epilepsy is due to a problem in the brain. Suppose he had sustained a trauma, there's a scar in the brain is there, probably it has to be taken for lifelong. So depends upon the cause for this epilepsy. That is the one. There's another type of epilepsy which is a genetic. That's called myoclonic epilepsy. They'll have a jerk like that. Such patients also have to take the medicine for almost a lifelong.
Okay. So next question is from Rashmi Limbachia. So मेरे हस्बैंड को पैनिक अटैक होता है और उसमें बहुत हेडेक होता है. पैनिक अटैक में is panic attack and headache common,
Panic
sir?
attack,
Is there a,
better they consult a psychiatrist. I think it is preferable they
okay.
go for a
So
psychiatrist.
it's not about a neurological problem.
It is not a neurological. It is not a neurological issue.
Done, sir. Chetna Rai is asking this question. My mother is a migraine patient. She is 48-year-old. It's been 3 years and she completed 2 years of course of medication, Betacap, Topaz, etc. She's taking other medicines like Elivel, Celibium 10. How long will she have to continue with this treatment?
I have told you, 6 months free from headache. If they can take the medicine for a free from headache, that is most important. 6 months, the drugs can be gradually tapered. It is quite
Okay.
commonly, I am not telling about this particular patient, quite commonly, they take medicine for about 2 months, 3 months, break it. Again, they relapse the headache. That's a common. I don't think it is so with this particular patient, but this is the usual protocol. 6 months free from headache, try to taper it and
Done, sir.
avoid the trigger.
So avoid the triggers. Yeah.
Triggers.
So next question is Roshan Kumar's question. My father is suffering from a neurodiabetics problem. Can we control this? I think diabetic neuropathy is what he meant.
It's a diabetic neuropathy. A diabetic neuropathy is treatment is only control of diabetes. And the
Okay.
diabetic neuropathy needs medicine provided the neuropathy is producing pain or burning sensation. If the
Right.
neuropathy is producing only numbness, everything like that, I don't think you need a treatment. But control the diabetes.
Done. So there are two questions regarding migraine and lifestyle diet trigger factor के लिए. Sheetal Gupta is asking, are there any lifestyle changes and diet which can help reduce the frequency and intensity of migraine?
Sure, definitely. Definitely. Most of the times, as I told you, the youngsters which we see here in Chennai, we see the IT people working there, no sleep proper, no proper food, I think. So appropriate sleep, appropriate relaxations, regular physical activity. Definitely it can this itself can bring down the frequency and the severity of the headache.
Right. So that is one. And Krati Singh is asking, I have vitamin D deficiency and I've been advised to go out into sunlight. But due to severe migraine, I cannot even step out because even for 5 minutes I step out, my migraine triggers.
See, if a person is not able to expose himself to the sunlight, he can have a sunglass, he can have an umbrella, you can
Right.
you can have it. I said some way that there are, as I told you, the common risk factors for the migraine is exposure to sunlight. You can modify it like that. And one, he need not be exposed to sunlight at mid noon. He can go between 6:30 morning, 6:30, 7:30, or evening. He can go. Preferably morning would be better. Morning 6:30 to 7:30, where the sunlight is not much. He can definitely and he can go back to the vitamin D therapy itself.
All right. Done. So there are two questions about headaches in particular. Lakshmi Pati Gaud, I'm getting headache after lunch at 2 p.m. And Gopinath is saying weekly one side headache followed by severe burning sensation. So 50-year-old male. Is there a pattern in this kind of migraine headache, sir?
Migraine headache, as I told you, it's an episodic headache. The headache is
Okay.
not daily headache. It's an episodic headache. Comes, say, weekly once, week or twice in a week, or monthly, or like that. So one can easily, if you can listen the history itself, you can easily identify that this is a migraine one. We can all that we need in imaging to support that nothing in the brain is there, and proper appropriate treatment. That is sufficient, I think.
Done, sir. So a lot of people who are asking about migraine, 30 years से migraine है, 10 साल से migraine है. Such people, I think sir has already given answer that there is possible treatment and continuous treatment. Dr. Dhanaraj can be consulted on Apollo 24/7.
Okay.
Because there are a lot of questions on similar kind of questions which I'll not be able to take up today. I think you've very well answered and very well explained, sir. I don't want you to repeat the answer. Well, sir, here's a question from somebody who worked out very intensely in the gym for a very long time, and he had pain in the thumb area which came out. And doctor said that it's a compression which is originating from your spine. Is this a neurological problem? Can this be treated?
See, if it is only thumb, I think you have to be sure it is, if it is only from thumb, nowhere else, the nerve can be compressed at the wrist. There is a condition called entrapment neuropathy here. The median nerve, there is a one nerve comes here, it can be compressed there. Unlikely a nerve root pressure. Unlikely. If
So
it is
this is
coming only,
mild nerve compression in right thumb. There is more detail here. Mild nerve compression in the right thumb due to physical, stressful, intense exercises. Does thyroid play an important role in doing the nerve compression
yes, yes,
issues?
yes. Thyroid. When the thyroid is low, when you stress more at the wrist, yeah, there is a nerve called median nerve which can be compressed in the wrist itself. It can be easily treated. It is a very minor problem.
Okay, done. It's a very so there is treatment available. Done, sir. So this is Akhon Khabar. Sir, I'm Kaushik Pal. Whenever I have tension in everyday life, I tremble like in vertigo. I'm using medication Tebocan Forte. Tell me what to do next and how long do I do take the treatment?
That is, whenever he is stressed, he has got a
Tremble and a vertigo.
tremor, vertigo,
Tremor and a vertigo.
tremor. See, he has given a clue. Whenever I stress, I have a vertigo, I have a tremor. Obviously, I think instead of going on to the medical treatment, I think you can cut short the first part, the tremor, I think. For vertigo, instead of depending upon the medical treatment, there are certain specific physiotherapies available. There are certain movements, eye and brain. There are certain physio exercise available. You can do it every day, morning 15 minutes and even 15 minutes. I think you can do that. You can get rid of the vertigo very easily. You can get rid of it, I think. And
Okay.
stress control. Yeah.
Done. Suvajit Mardana. Suvajit says that 38-year-old, I felt pain twice in my beside the ear at the time of intercourse. First time I felt very much pain. Is this a neurological problem?
There is a type of headache, I know, not the ear pain alone. There is a type of headache which can come on immediately after this intercourse or during the coitus, either during or just after the coitus. There is a treatment for that one. They can take up a medicine called indomethacin. They can take, there is a medicine is available here, I think, indomethacin, that can be taken about an hour or prior to this coitus, it can be taken. They can be get it. But avoid a major problem. There is a major problem, we call it as an aneurysm. When you have a stress or a coitus, at that time they have the specific headache. You consult a neurologist or a neurosurgeon to rule out a condition called in some blood vessel abnormality within the brain. That is a must.
Oh, so Suvajit Mardana, you can consult Dr. Dhanaraj on Apollo 247. The link is given in the chat box as well. Well, so this is a 7-year-old female had headache, blurry vision for 3 hours, was fully conscious but was dizzy. MRI, 2D echo and VEP are normal. No problem detected by an eye specialist also. What could this be?
Straightforward. You have a eye problem followed by headache. Young person, everything is normal. It is a migraine. I told you, the migraine is the one, it has got an aura. You have a
Right.
visual problem, subsequently followed by headache and vomiting. Everything is normal. Imaging is normal, eye is normal. So it's straightforward. It's a migraine coming at a younger age. That's all.
That's it. All right. So there are a lot of people who are asking about they've been taking certain painkillers for migraine or headache for a long time. What do you advise these over-the-counter painkillers and long-term usage? Mr. Jha was asking this question.
See, there are certain painkillers may not be very harmful. May not be very harmful. For example, paracetamol, Ultracet. If it taken judiciously, may not be harmful. But Certain painkillers, like say ibuprofen or nephrosin, if you taken more longer time and without any restrictions, it can harm the kidney. It can
Oh,
end in a kidney failure. It can produce
okay.
gastritis. It can produce a gastric bleeding. So avoid not to take such painkillers without doctor's advice.
Done, sir. This is Dr. GBK asking a question about his son. Last month he got AIDP variant, IVIG given. How many days to recover? I'm not sure if this is a neurological question because of the abbreviation, sir.
This is a very simple, common neurological problem. It's called acute inflammatory demyelinating polyneuropathy. The treatment of choice is IVIG. The recovery
Okay,
usually the recovery takes it is a very disease can be easily treated. It might after giving IVIG, it might take 1 month, 2 months, or up to 6 months. It may take a time. They will improve. The prognosis is very good. They'll do well.
done. Sir, you were talking about diabetic neuropathy and its management. There are two people who are asking about neuropathy problem. They've not mentioned diabetes here. Thakur Surya Pratap Singh says he has pancreatitis and neuropathy. Can this be managed?
What is that? Neuropathy.
Pancreatitis? He
Any
has pancreatitis
pancreatitis,
and neuropathy.
yes. Neuropathy is a complication of diabetes. Whatever, whether is after all the insulin is secreted from the pancreas only. So any disease with pancreas can, when it is impaired, the insulin secretions can produce end in diabetes only. So diabetic neuropathy is very simple. It is not at all a difficult problem. The basic is treat the neuropathy, treat the diabetes first. And the
Okay,
neuropathy, only if there is a pain, weakness, or burning sensation, you need a drug. Otherwise, you don't need
done.
any medicine.
Okay. So next is Krishna Chandra Datta. Sir, my father's hand is shivering while holding a spoon, etc. 67-year-old. He's facing this problem since few months. Is this a similar kind of Parkinson's that you were mentioning, sir?
I'm not sure. As I told you, Parkinson disease, in addition to tremor, there will be slowness of movement. There will be stiffness of the muscles. When all the three are combined only, we call it as a Parkinson's. So just because a person has got a tremor, it may be age-related tremor. So it
Good,
may be
correct.
like that. One has to examine and find out whether it is a Parkinson or just an ordinary tremor it is there.
Okay. So this is Kranti Kumar who's saying that he got diagnosed with Bell's palsy on the right side of face in 2017, still not cured. Any treatment or remedy available now?
Now, you see, the treatment for Bell's palsy is to be treated within the first 5 days of Bell's palsy. We give steroids, and that there is another medicine called acyclovir that has to be given the first within the first 5 days. Once occasional patient, when the Bell's palsy is severe, it may not recover well. It may leave behind. Particularly now, it is after 3 years, 4 years. I think it is very difficult to treat at this point of time. But cosmetic purpose, if they cosmetically the face looks very awkward like that, they can consult a plastic surgeon. They can go in for a little reconstructive surgery. They can go for.
Okay, okay. So otherwise, there's no other continuous treatment,
Oh,
as you said. Done, sir. So next question is Jay Prakash Pandey. What is the reason of tinnitus and burning in hand and ankles? Also burning in the head backside, ears also burning. JP Pandey from Lucknow.
See, there is this particular pattern of burning sensation here, 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 here. It doesn't fit into any or particular organic pattern of neurological problem. I think one
Okay.
should ask for any stress, look for any basic problem like anxiety, stress, or depression, something like that. It is there. It has been. Most of the neurological problem follow a strict anatomical pattern. They don't come in a bizarre way. They don't come like that.
Done. Sir, Virender Kumar is asking a very common but an interesting question. Sir, is there a relation between acidity and headache? Because acidity pushes to headache. What's the solution for that?
No, it is not acidity is getting the headache. It is an aura. As I told you, aura is one condition. The aura can be several types of aura. One common is the visual aura. Second is the gastric aura. You have an abnormality here in this one. So this is an aura prior to the onset of headache. So this has to be treated like any other migraine. That's all.
So it's not because of acidity that the
It
headache
is
is
not.
coming, it's because of
It
the
is an
headache that
aura.
acidity is.
It is the aura which comes as a gastric symptoms, I think, subsequently followed by headache here, I think. So if you can, I'm sure you can consult any neurologist. I think it can be managed successfully. Nothing to get.
Thank you, doctor, and thanks to Virendra Kumar for asking that question because there's a cyclical pattern to it we need to understand about it. Thank you. So, next question is Tejas Balamwar. My father in law has suffered a brain stroke 5 years back, but is still unable to recover with respect to mobility. Body parts have not fully functional. How to treat?
Now, see, there is no medicine to improve the muscle power after a particular 6 months or 9 months of stroke. There is no medicine is available here, I think. But if the muscles have got spastic, see, sometimes after the stroke, the muscles go into stiffness and spasticity. There are some drugs are available to control the spasticity. There is also an injection called Botox. This
Okay.
Botox injection can be given in the stiff muscles. It can relax the muscles. So he has to be seen by a doctor, assessed whether the stiffness, spasticity is there. If any one of there, I think it can be managed to some extent.
Done, sir. So similar question, sir. Rakshak is asking, father 62-year-old had an stroke in the right brain 9 months ago, leading to a left dense hemiplegia. He's been on physiotherapy at home. What else can be done?
Physiotherapy, rehabilitation, as I told you, check whether there is a stiffness or not. If stiffness is not there, I think you have to do a physiotherapy. I have already told you that in stroke, one third of the patients will be left with a moderate to severe neurological deficit. That is why I told you
Right.
this thrombolysis is the best treatment if a person gets stroke.
Okay. So is there a time frame for such patients to recover?
Usually 6 months. Usually every stroke patients have got usually the brain, even the opposite side brain can also help at a period of around 6 months maximum. Once they cross the period of 6 months, only physiotherapy, active physiotherapy is only it is going to be help. As I told you, spasticity. If the spasticity is there, now recently we have Botox is available almost everywhere. Anybody can give this Botox there.
Okay, sir. So Shriyanshi is asking, my sister's head is spinning since last 4 days. She has a sensation of loss of balance. It feels as if she's pulled to one direction. Does it indicate any issue with brain or nerves?
Commonly, if this is a rotation, this rotation, otherwise called the vertigo, is one of the very commonest symptom. It is actually common cause is due to a ear problem. The middle ear gets there is some problem, you get this vertigo. Anybody who has got this vertigo, there will be an imbalance. There will be sweating, there will be vomiting. All the four go hand in hand. They can be treated with a medical treatment. There are a lot of medicines available with vertigo. But if the vertigo is associated with speech problem, numbness one part of the body, it may be a manifestation of stroke also. So
Oh,
this
okay.
it can come isolated vertigo with imbalance. We can ignore. We can treat medically. But vertigo associated with other symptoms like speech problem, numbness, weakness of any part of the body, think of stroke.
Right. Thank you, sir. So this is Satish who's asking, they had CVT and how many years do I continue with tablets?
Yes. See, the CVT or the cerebral venous sinus thrombosis, usually what has happened is most of the patient, it will be, incidental. We pick up it, treat it for about 3 to 6 months, and then we can stop the medicine. In case if there is a problem in the blood, there are certain proteins in the blood which aggravates clotting. There is a process called protein C, protein S, like that. They will help to produce clotting further. If such problem is there, the medicine has to be taken for a very prolonged time. If that is not there, common CVTs, particularly during delivery time, they get a CVT. Give the medicine for about 3 months, 4 months, they'll become all right. If any one of such protein abnormalities is present, the treatment has to be continued for a very long time. Otherwise, it is not necessary.
Okay. Thank you, sir. So next question is taking the medication for migraine for a very long period, but the relief has not come yet. Will there be any side effects of taking these migraine medications for so long?
Definitely. All migraine medicines have got side effects. All medicine, immaterial of this one, whether it is a propranolol, whether it is a sibelium, flunarizine, whether it is a topiramate, whether it is a sodium valproate, anything, every one of the medicine has got some side effect. It is always preferable they have a consultation with the doctor once in 2 months or 3 months.
Done.
No self medication.
No self-medication. Okay. Pamela Das is asking, I'm having severe pain in left side behind the ear, unable to understand if it's migraine or not, especially it comes in summer. Please suggest.
Is it the pain is coming every day? Have they,
Okay, Pamela Das ji, can you please, severe pain in left side? No, I don't think. Can you please answer if it's a daily headache or not? In the meanwhile,
headache or ear pain?
behind the ear
So
must
behind
be
the
a
ear,
headache.
ask them to have a consultation with an ENT also first. I think let them see first
Okay,
an ENT doctor. That will be better.
okay, done, sir. Sir, what is hydrophilasis and is that something related to neurological conditions?
Don't get it. Hydro.
Hydrophilasis. Satyabrata Naik was asking, can hydropalasis can be treated by medicine? I'm not sure if that is a thing. But anyway, doctor, you were very, very patient in answering questions. One last question that I would want to take up is, my wife is your patient, Anirban Singha, suffering from mild polymyosity, taking steroids regularly for last 2 months. Currently under your treatment, she still feels dizziness sometimes, which obstructs her movement.
See, I remember the patient. I remember this particular patient here, I think. See, polymyositis is an immunological disorder where we give a treatment of steroids mixed with other immunosuppressive drugs. In general, steroids do not produce dizziness. So I remember still well, we stepped up the dose of steroids gradually up. At particular point of time, she felt giddiness. We tried to taper. In case they are not able to bear with steroids, steroids can be supplemented by other drugs. There are other immunosuppressive drugs are there which can be combined with the steroids. In general, polymyositis is a treatable condition, but it takes time. Maybe it may take about 3 to 6 months for her to improve. I still remember that a girl, I think recently married one. I think she can go back to her work. I think she can do well with this treatment.
Done, sir. Thank you so much. There are a lot of people who are asking about headaches and migraines and BP headache. One question, Ankit Sethi says 33-year-old male hai. इनको समझ में नहीं आता if this is a headache because of migraine or because he has 140/85 BP. Is this headache because of BP?
140/85 BP does not produce headache.
Okay.
That is not.
So that could.
No, that is not.
Okay.
That
Anil
BP is
Kabraji,
not.
I missed your question. Yeah. Done, sir. So it is not a BP headache, so it could be a migraine headache, and he should consult and he should.
It is not a migraine.
Done, done. So Anil Kabra's father had a stroke 6 years ago, and he is normal now. Is there a chance of him getting the problem again? He's 84-year-old.
What problem? Headache. Huh?
Brain stroke.
See, there is a problem. Once a person is affected by a stroke, the long-term complications, there is a chance of recurrence of stroke. One. Second, there is a chance of getting a heart attack. Two things are there. When a person is affected by a stroke, during the follow-up period, there is a high risk of stroke, there is a high risk of heart attack. So we put them on secondary prophylactic treatment, either antiplatelet drug and statin. We tell them to take it for lifelong. One.
Okay.
Second thing is all the risk factors, BP control, diabetic control, not to smoke, should be followed. So in addition to the risk factor control, these blood thinners and the statin should be a lifelong treatment.
Done, sir. So you were extremely patient and very, very informative. It was a great session with you, sir. Thank you so much. We appreciate your time for today, sir. Thank you. Before we leave, take leave from you, I request you to give me top tips to take care of neurological health.
See, there is no such thing as a specific neurological health care. In general, neurological health care consists of one is a lifestyle modification, regular physical activity, a balanced diet rich in fruits and vegetables you have, then no smoking, no alcohol, check the BP regularly, check at least after the age of 45 or 50 years, check the BP at least once, check a master health checkup. Avoid all the tiring factors in one and lead a happy, comfortable, relaxed life. I think this can make most of the patients lead a very happy neurological, a normal brain they can have it. There should not be any problem.
Wonderful, doctor. Thank you so much once again. We appreciate this time of yours on a Sunday morning. Namaskar, vanakkam. Thank you. So that was Dr. Dhanaraj with great excitement that he answered all your queries. We now have 3 questions for you, which is a health quiz coming up. Answer the questions in YouTube chat only, and I shall announce the winner's name towards the end of the show, and winners will be selected by the sole discretion of Apollo 24/7 team. Winners to mail your contacts details at marketing@apollo247.com, and gift vouchers will be shared with you. Get ready. 3 questions for today are: question number 1 for today is, how many parts is human brain divided into? How many parts is human brain divided into? And question number 2, when is World Brain Day celebrated? Question number 2 is, when is World Brain Day celebrated? And the last question for today is, under one tab doctor consultation service, in how many minutes can you book appointment with top Apollo doctors? Last question, I repeat, under one tab doctor consultation service, in how many minutes can you book an appointment with top Apollo doctors? These are the 3 questions for today. Go ahead, type your answers in the YouTube chat box, and we shall get you the winners list in a short while. Before I announce the winners, let me also give you one clue and also an exciting offer. Here is just one tab. Consult an Apollo general physician in just one tap. Talk to a general physician online in just 15 minutes at rupees 249 rupees only. You can book the consultation right now. मेरे question का answer भी यही है. चलो फटाफट answer type कर लीजिए YouTube chat box में. You can be with the winner. And thank you all of you for joining us today. We have gift vouchers to give away. Use this code HH247. Get 199 rupees off on online consultation with Apollo doctors, and also 20% off on medicine orders. You can. इसको यूज करने के लिए पहले आपको Apollo 247 डाउनलोड करना पड़ेगा, and then you can use these coupons. Coupon code is HH247. आज के winners है रितिमा सेठ and Rakshak AR. Congratulations. And the third winner is Pushpa Ramesh. Please write back to us and claim your gift vouchers from Apollo 247. It was an insightful session. Thank you so much for all these questions, because your question is answered to many more people. Next week, we are going to meet you in a wonderful informative session from Apollo expert, dental problems, causes and prevention. Tune into Health Hour on Sunday, 20th March, 11 a.m. If you do not want to miss the session, there's a bell icon. Go ahead, subscribe and add to your reminder list. Thank you once again, all of you, for joining us today. It was a great session. Next week, we shall see you on Apollo 24/7's Health Hour, same time. Namaskar.